Hi, Dr. Ariane from the Movement Paradigm. Did you know that your nails, among many other things, can be a great indicator of your nutritional status, and you are able to identify some preliminary nutrient deficiencies before you might even see it on lab work? We're going to talk today about a basic nail exam that you can do to identify any potential nutrient deficiencies. That way you can discuss this with your doctor, your functional medicine practitioner, your dietitian, to really make sure that you are assessing for what you are or are not getting in your diet, and potential lab work to confirm any findings. Nails take approximately 6 months to regenerate, specifically the fingernail, and approximately a year for the toenail. So this is a living tissue that we are able to see a lot, and as I mentioned, you are able to often see nutrient deficiencies months before it may show up on lab work. Now today we're going to keep it fairly simple, and we're going to look at things like the shape, the color, the lunula, the texture, the rigidity of the nails. So we're going to, like I said, keep it pretty basic, but also be able to identify if this may be an issue for you. For example, if there's a postmenopausal woman who has brittle nails, it would be really important to check for bone density, because this can be a preliminary finding that we see. When performing the nail exam, we'll start by looking at the shape of the nail. So we ideally want this to be a nice round shape, and this is also where we'll look to see if there's any clubbing in the fingers. This would be very noticeable, but is more indicative of any type of systemic issue like cardiovascular disease, irritable bowel disease, mercury alcohol toxicity. Then we'll look at the color of the nail. So you want to have this nice pink hue to it. When it's a little bit paler, it can indicate an iron deficiency anemia. If there are any brown lines, that can be indicative of some arsenic toxicity. And if there's any bluish hues, that can be indicative of some copper toxicity. Next, we'll look at the lunula, and that is this little white round part at the base of the nail bed, and that should be present on all of the nails. It might be very small or absent on the pinky side, and that's okay, but that is indicative of protein status, so you do want to see that on all the nails. And then also looking at the nail strength, so really testing and feeling the nail to feel how firm it is, how strong it is. Does it feel like it's easily breakable, where your patient might report that, or client? Then you want to notice that that would be also indicative of protein status. The next would be your texture. So is there any ridging? If there's some vertical ridging, that is common as we age, so you do want to take that into account. But if it's a little bit more severe, that can be related to protein deficiency as well. And then next we'll look at the capillary refill. So here you're going to press down, and in 1 to 2 seconds it should refill. So press down, should turn white, and then refill. If it takes longer than that, 3 seconds or more, then you know there's some type of circulation issue as well. And that could also play into any type of related issue from alcohol, stress, gluten, and protein deficiency, and also zinc deficiencies as well. This, of course, is just scratching the surface of a physical examination to look at nutrition. However, it is a start, and it is a way for you to begin to assess your nails and even your nail history. Also looking at your toenails, is there fungus that can indicate some systemic candida overgrowth. So there's lots of signs and symptoms that we see in our nails that we might not be totally aware of. So hopefully this was helpful. If it was, give it a like, give it a share. Make sure to subscribe to our YouTube channel, The Movement Paradigm, for weekly tips on mindset, nutrition, and movement. And if you need help looking into your nutrition and really trying to optimize your health, please reach out. We would love to help, virtual or live.